Good afternoon, everyone. My name is Elizabeth Debut, and this is my Module 6 discussion over dermatology. In this recording, I'm going to play both the nurse practitioner and the patient. The scenario that we have is Justin, who is 16 years old, and he comes into the office to see me because he has a red rash on his upper right chest. So we can go ahead and get started. Hi Justin, my name is Liz and I'll be asking you some questions today. To start with, what brings you in? Well, I have a reddened area on my upper chest on the right side. May I look at the area? Yeah, sure. I will need you to remove your shirt, so I'm going to give you this drape to cover up with, then you can expose the area for me to look at. Okay. Yes, I see the reddened area that you're talking about. When did you first notice the rash? Probably a couple days ago. Did it appear suddenly or did it appear slowly over time? It appeared slowly over time. Is this the only location or is it in other places? This is the only location. How long has it been there? Well, it's been there a couple days now, but I could feel it coming on for about a week. Describe it for me. What does it feel like? Well, it itches, and you can see that it's kind of round and red. Feels kind of bumpy, and sometimes the itch can be pretty intense. Does it hurt? No. Does it burn? No, it doesn't burn. Have you started using any new body spray or cologne or laundry detergent or maybe new bath soap or body wash or new lotion? No, everything is the same that I've always used. I don't think my mom's bought anything new. What helps the itch? Well, I did try putting some lotion on it, but it still itches, and I haven't tried anything else. What makes it worse or makes it itch more? Well, if my clothes touch it, that itches it, or if I'm sweating. I try not to scratch it. Okay. On a scale of 0 to 10, with 10 being the worst, what would you rate the severity of the itching? Probably a 6 to a 7. Have you ever had this rash before? No, this is the first time. Have you been in contact with anyone else physically? No. Well, I played basketball with my friends yesterday, but I had my shirt on. Justin, have you had any other symptoms with this rash, such as a fever, chills, nausea, vomiting, or night sweats? No, I haven't. Just the itching. Well, Justin, thank you for answering my questions. So testing that could be performed for this patient could be a fungal culture for ringworm, but it's more than likely, if it was ringworm, that they would be able to diagnose it just from looking at it and noting the pattern of the rash. And ringworm is also called Tinea corporis. An appropriate treatment would be an over-the-counter medication such as clotrimazole, which is also known as Lotrimin or Misalex, or miconazole. These preparations are normally used for 2 to 4 weeks to make sure that the fungal infection is cleared up. If the rash is really bad, then the patient could be treated with oral medications such as terbinafine, which is also known as Lamisil, or ketoconazole. My differential diagnoses included ringworm and eczema. Both diagnoses include reddened areas on the skin. Both can itch as a symptom in addition to have scaly skin. But with ringworm, it's more likely that the rash will become circular with a clear center, which is the presentation of the picture provided. Tinea corporis typically presents as a well-demarcated, sharply circumscribed oval or circular pattern, mildly erythematous, scaly patch or plaque with a raised leading edge, and pruritus is a common symptom, according to Long et al., 2020. Okay, thank you for listening to my recording. Have a great day.